So I am Pat Hodges. I work for the Department of Community Services here in this building. Our community services, community care division handles a multitude of different services. I and several of us provide information and assistance to the general public, anyone who is asking. They're signing up for Social Security, they're signing up for Medicare, they lost their Medicare, they signed up with the wrong Advantage plan, and how they want to get out of that Advantage plan. So we help them sort all of that out, get them back to where they want to be. A lot of that is through the state health insurance program called SHIP. We help people with anything Medicare, prescription drug plans. We annually review prescription drug plans. We update your prescriptions to make sure that you're in the best plan. We're an unbiased, free service to the community. We don't make any money off of that, so we're simply trying to save you money and make sure that your medications are covered. If they're not, we help you to find ways, either a different plan, or we have you talk to your doctor to request a waiver. Jennifer Hall, who is going to be here today but is out not feeling well, she handles our Senior Medicare Patrol, which is SMP, which increases people's awareness to healthcare fraud, scams. Scams are widespread, and seniors are a vulnerable target. We encourage people to report anything that seems too good to be true. We get a lot of calls from our clients that say, I got this message, and I think I need to call them back, and it could be the lottery. And our first question is, do you play the lottery? Because if you don't play the lottery, they're not going to contact you. And so we are always driving that. Don't answer if you don't know the name, you don't know the number. If it's important, they will leave a message, and then you can get back with them as needed. I am the local long-term care ombudsman for Queen Anne's County, so I advocate for residents who reside in nursing homes and assisted living facilities throughout the county. I will investigate complaints and concerns from anyone who calls our office with a concern. Everything we do is confidential. We cannot discuss it with any other people other than another ombudsman. We have to get consent from the resident, whether they have capacity or not. We have to speak to the resident. And if the resident says, my daughter, or I say, do you want your daughter to visit? Because another family member doesn't. If they say yes, then that's what we advocate for. If a resident wants to have a glass of wine every evening, even though the nursing home is saying it's not good for them, they shouldn't do it, if that's what they want, that's what we advocate for. That's their home. If I want a glass of wine at home, I have a glass of wine at home. So they're our focus. Anyone can make a complaint through us or the Office of Healthcare Quality. You can do it anonymously. I can make a complaint on behalf of several residents if it's the same problem that's affecting, say, an entire unit. Pretty much I go and just talk to people and educate them on what we do and that we're available to them, and that try and get them to understand that we're there only for them. We want them to be happy. We want to come to a conclusion that will satisfy them in the best way possible. Sometimes you don't win. Sometimes you just can't, especially with family dynamics. That creates issues sometimes, where brother doesn't want sister to go see mom and vice versa. But we are resident driven. So whether the brother doesn't want to see have the sister there or not. If the resident does, that's what we advocate for. And lastly, we are the agency for the Maryland Access Point. We are the gateway to long-term services and supports in Maryland. MAP specialists work with caregivers, professionals, and all individuals with long-term care needs to plan, identify, connect, and assist with assessing private and public resources for long-term care services and supports in our county. So we're the one call. You call the MAP line, and from there, they find you resources. We don't want you to say, okay, you need to call this person, and that person sends you right back to us. We try and direct you to the people that can actually help you quickly without you getting a multitude of phone calls. We are very proud of our department. We're very good at returning phone calls and emails. We don't leave you hanging. So if you have any questions, feel free to call us at 410-758-0848. And thank you for your time. Any questions? Yes, ma'am.
Because I've visited nursing homes a lot. I was just thinking, you said, how you help the residents. What about the ones that are in the dementia area?
We help them as well.
You help them?
Mm-hmm. We go and visit them.
If they're having dementia, how can you determine whether what they're saying to what's correct and what's not?
Sometimes you have to kind of weigh it out as to what they really want. So we just ask generalized questions. Most people with, I've had cases with dementia patients where, exactly that. Yes, of course I want my daughter to visit. That's what I advocate for. Unless that visitor is presenting an issue with the resident, either they're getting upset or, they're crying, and it doesn't do well for the resident. We're looking to keep the resident safe. Sometimes we'll go to the power of attorney, but we can't do that without speaking to that resident. So if I go in and tell a resident that we received a call of concern for whatever reason and ask them permission to investigate, if they say no, we can't do anything. So they have the right to refuse our help. And in that case, I would call the person that made the complaint back and say, I spoke with the resident and I did not gain consent to investigate the issue. What I then do is try and go to other residents and see if it's happening throughout. And then I can do a general complaint without naming anyone. But you still want to go back to the resident and talk to them and say, how would you feel if I did this and your name wasn't involved? Sometimes they're like, oh, okay, as long as you don't use my name, it's okay. So there's ways where you can kind of determine if they're on board or not.